مساء الخير. It's a pleasure today to introduce Dr. Ayed Hawatmeh and his wife, Dr. Negar Hawatmeh. They are both well-known practicing dentists in Southern California for the last 15 years. أهلا وسهلا فيك دكتور عايد، أو بالأحرى أهلا وسهلا فينا نحن عندك بالبيت وعند دكتور نيجار. شكرا لكم، شكرا على الاستضافة الحلوة.
Of course أهلا وسهلا فيكي. بحب أتشكر وجودك معنا اليوم، وبحب أتشكر MTV على اللقاء الحلو. It's a pleasure to have you in our home.
Thank you so much, my pleasure. مثل ما ذكرت بالانترودكشن 15 سنة من الخبرة وبعالم طبابة الأسنان، ولكن قبل هال 15 سنة في سنين كمان، سنين انتقالك من بلدك الأم الأردن، وصولك للستيتس، تخرجك، لقائكم. يا ريت بتخبرنا هيك عن هالسنين اللي مرقت.
أنا تركت الأردن، هاجرت بسنة 1990. كملت الهاي سكول في يوتا، ستيت اوف يوتا. بعدين انتقلت كملت البكالوريوس في University of Utah. وبعدين قررت انه اعمل طب اسنان، فانتقلت ل University of Southern California USC Dental School, and that's where I met my wife Negar,
and the story
began. Yes. And then we took off.
Yes, so that's where it all began. My husband and I met at USC School of Dentistry in Southern California in Los Angeles. My background is I was born and raised in the US. I did my undergraduate degree at UC Riverside in biochemistry, and then I went on to USC School of Dentistry where I completed my dental education and met my husband. I have now also been practicing for 15 years. I do general dentistry, and I have a personal passion towards cosmetics. I do a lot of cosmetic dentistry, and it's a personal passion for me. And aside from being a dentist, I am a mother of 3. I have 3 children. I have twin boys that are 4 years old, and a daughter who's 6 years old.
So impressive.
Thank you.
A beautiful working mom and successful.
Thank you.
I envy you, doctor.
Oh, thank you.
Thank you.
It took a lot of work, but finally the hard work has paid off.
Yes.
من بعد هاللمحة السريعة عن حياتكم الشخصية وكيف تم التعارف وكيف أسستوا هالعيلة الحلوة وهالمهنة الحلوة جدا. I would like to hear more about your offices and work, Dr. Ayed. Walk me through what happens if I call your office for a first time appointment. باخد موعد على السريع ولا I'll be on a waiting list? A long waiting list.
طبعا إذا أنت بتتصلي we'll see you right away the same day for sure.
Thank you.
لا بس عادة the first call there's specialized staff that would take your information, schedule the appointment and bring you in. طبعا we have to do a complete review, medical history, just make sure إنه ما في complications that could interfere with dental treatment.
Okay.
We take all the proper scans and x-rays, all the necessary records, and then we sit with the patient. We see what their needs are. لأنه each patient really كل مريض له احتياجاته الخاصة. So we have to listen. What is it they're here for? What is it they're looking for? Can we meet their expectations? لأنه we've had multiple episodes. We had patients come in, they want this perfect smile and they want the Hollywood smile. So we really have to sit down together and design that smile they're looking for. So once that's set, we go ahead and proceed. In our practices, we also have board-certified specialists that can deal with all aspects of dentistry in the office. So we try to keep all treatment in one office, under one roof, which gives a lot of convenience to patients. I know a lot of the patients don't like to move around. ما بيرتاحوا إنه to go from office to office and to see different doctors. So we try to keep it in-house. So we do it all. We do, whether it's implants, whether it's veneers, whether it's whitening, whether it's even simple filling or a crown. All my doctors are professional. They're all experienced, highly trained, and they're all board certified. So we try to set it up together so we can take care of all your needs in one shot.
So الهدف الأساسي or the main focus about your dental practices is the patient?
طبعا 100% الفocus على البيشنت. We try, when we design the offices, when we build them, when you walk in the office, we want to give you an impression you're not in a regular dental office. You walk in, you feel like you're home. You're in a living room, comfortable setting, TVs. So even when you walk in the operatory room, it doesn't look like a traditional operatory room. Like I'm sure a lot of people are scared of the dental chair. So we created this environment. When you actually go in the operatory, you just see the regular chair, and you see there's monitors. You can watch TV. You could listen to whatever music you want to listen to. You don't see the traditional machinery that goes along with in a normal setting, in a normal operatory setting. So it calms patients down. It gives them the confidence they need. So they can
يعني
trust us
المريض
with
بيكون
it.
مرتاح وبياخد النتيجة المرجوة من دون ما يكون معقد من هالعقدة اللي نحن وصغار بنخاف منها، هي طبيب الأسنان.
طبعا
يعني بيكون فايت ومرتاح.
طبعا absolutely.
Dr. Negar, everyone I meet wants to have this amazing cosmetic smile. And I really think that it's something very important to be confident while smiling. Please tell us more about the cosmetic dental makeovers that you do.
So you really hit it in the right place. It's very important nowadays. And you know, we live in such a society where people are so health and beauty driven. Everybody wants to be beautiful, everybody wants to be healthy, and everybody wants to live well and live long. You know, 50 is the new 30, so we all want to look great. A huge part of that is our teeth and the smile. So often when I see our patients, my first thought is, do their teeth match them, their personality, their youth, their lifestyle? And that's so important that sometimes people lose track of. So we have individuals that are doing yoga and eating well, yet their smile and teeth don't match them. In our offices, we do a very extensive, we do a lot of extensive work and offer a lot to patients in terms of what they could do to have the perfect movie star smile. And almost anybody can nowadays, anybody. We do things as simple as, for the patients who come in with beautiful teeth, like you already have.
Thank you.
You can have whitening. You can just do whitening of your teeth. You can change fillings that have been metal that were maybe placed as a child. We can change those to white. We could do crowns that are metal free. For patients that need more extensive dental work is where we see patients that want full restoration, change. And these are patients that are going to come in and want what they call now the Hollywood smile, the movie star smile. For those patients, we do full veneers, where we do veneers on the top teeth and the bottom teeth. And those are ceramic, and they allow us to really do anything with a person's smile. We can make your teeth bigger, smaller, we can give you a fuller look, which quite often for most patients, they love it. It actually not only improves their smile, but it also improves their lip line, wrinkle lines, it makes the face look fuller. And my experience is when we do procedures like that for patients, it's life-altering. They are, I mean, they come in one way and they leave dancing away.
Feeling younger.
Absolutely.
More confident.
And they're much more
No need for Botox anymore.
There you go. So a lot of them really say that it's made such a significant difference in their life, whether it's with their spouse or partner, whether it's through socialization, whether it's that they are more comfortable talking more, they find themselves smiling in pictures now. So this is an aspect that for us is very rewarding because you see that you make a significant difference in a person's life. And that's really a lot of the patients that want that major change. Now we have some patients who will say, well, I've lost teeth in my lifetime. Can I really do all these things that you're talking about? And for those patients, we have lots of options where we can do implants now.
Implants.
So losing teeth is no longer as big of a deal as it used to be because we can just put implants back in, give them the beautiful smile, and then it's our little secret. They don't even know they were ever missing teeth.
Great.
Yes.
Dr. Ayed, Dr. Negar just mentioned the dental implants. Please, could you tell us more about the dental implants in your office?
Of course. Dental implants have become a really important part in our practice, our daily practice. On daily basis, patients walk in and they ask about them, which made us switch a good portion of our practice for dental placement and dental education. So we had to go get extensive training to place implants surgically. I personally placed thousands of implants. I've done thousands of surgeries. And we've learned quite a lot about them. And the technology has really advanced. Believe it or not, over 90% of people are actually, they qualify to get implants, which is surprisingly, a lot of patients don't know that and they don't believe it. So what we do throughout the whole process is to take the proper scans and then we determine whether you're a good candidate or not. And once that's determined, we go ahead and explain the whole procedure and how it's done, and then we go ahead and schedule the surgery.
Dr. Negar, but many people, a lot of people are scared of getting any dental work done. How could you help scared patients?
So in the many years of practice that we've had now, I fully acknowledge and we realize that people love to see us socially. They don't necessarily like to see us in the dental chair. One of the most important aspects is that in our practice, our philosophy is to really treat others as you wish to be treated.
Yeah.
So when patients come in and they seem fearful, the first step is we'd like to just sit with them and have a nice conversation and get a feeling of meeting a friend or a family member versus a patient. That a lot of times makes patients very comfortable. If that alone doesn't, and patients are still very fearful, we do offer a variety of ways of making patients calm, whether they want to take some sort of form of medication where it helps them be calm, but they're still awake. We also have a general anesthesiologist who's a medical doctor who can come to our practices and put patients to sleep if they'd like. So they can go through sleep dentistry and wake up and their teeth are all done like magic. So it really helps patients that are fearful, and we're very sensitive. Yes, yes.
Absolutely.
دكتور عايد، أنا وفريق العمل وأكيد كل المشاهدين اللي عم بيتابعونا استمتعوا بهالمقابلة ومنهم حابين أبداً إنه تخلص. بس عندي سؤال أخير، الأشخاص اللي ساكنين برات كاليفورنيا الجنوبية كيف بيقدروا يتصلوا بالعيادة وياخدوا موعد ويحكوا عن الدنتال وورك تبعهم الخاص فيهم؟
بلشنا actually من عدة سنوات. كان يجينا عدة مرضى من الدول العربية ومن دول الخليج، فلهذا السبب احنا عملنا ديبارتمنت كامل. لما البيشنت بيتصل بده يعمل ابوينتمنت، بده كونسلتيشن، سيت اب كونسلتيشن، فالتيم بيحجز لهم كل شيء، يعني الطيران، الاوتيل، حتى their families، العيال لما بتيجي معهم we plan الستي لهم كاملة.
travel agency.
زي almost زي الترافل ايجنسي، لأنه لما بيجي البيشنت من دولة تانية، من دولة عربية لأمريكا،
أكيد.
طبعا جو بيختلف، خصوصا أنهم جايين يتعالجوا هون، فبنحاول نعمل الإقامة تاعتهم تكون كتير مريحة جدا ونسهل عليهم الأمور على أساس كل شيء يمشي تمام. ونشكر الله أنا كان يعني سكسس كبير لهالعمل، وإن شاء الله we'll continue.
إن شاء الله أكيد. شو بتحب تقول كلمة أخيرة لكل اللي عم بيتابعونا؟
أول شيء بحب، آخر شيء actually بحب أتشكر وجودك again معنا. بحب أتشكر التيم كاملة، وبحب أتشكر الام تي في لوجودهم معنا، والمانجمنت للام تي في بلوس أنجلوس وكاليفورنيا. وبحب أقول إنه هلأ طب الأسنان صار جزء مهم جدا من الهيلث للإنسان كاملة. So it's very, very important to maintain your health of your teeth because it's really integral part of your overall health as it affects it affects the teeth and your heart and your overall condition is all connected. So that's هلا المنتاليتي تاعتنا to put everything together and educate people and educate patients about it.
أكيد. Dr. Negar, your closing thoughts, please.
It has been a great pleasure to meet you and work with you. Thank you for coming.
Thank you so much.
And overall, as a dentist, I feel that people's well-being and health is very important. I love to see people enjoy their life, live a good life, be healthy, and be in the optimal condition that they can be. And in my opinion, every patient that comes into our office to me is a part of our dental family. And from there, it's very important for us to educate, whether we are talking about kids as young as 2 years old, to make sure that they learn how to take care of their teeth and keep them clean in their diet, or whether you are my 96-year-old patient who's in my practice as well, who has lived a great life and has maintained his teeth. He's been able to be functional, to chew properly, live a healthy life, and smile and be very, very happy about his overall life. So that is my philosophy about dental health, and I'd love to see everybody smile.
Thank you so much. We wish you all the success. مشاهدينا أنا كمان بدي أشكركم لمتابعتكم. إن شاء الله تكونوا استمتعتوا واستفدتوا من هالمقابلة ومن المعلومات اللي عطونا إياها دكتور عايد ودكتور نيجار. بالنهاية بدكم سنين حلوين، بدكم كوزماتيك سمايل، بدكم امبلانتس غير شكل، ما إلكم غير إنه تتصلوا بعيادات دكتور عايد ودكتور نيجار بكاليفورنيا الجنوبية. وأنا بقول لكم تصبحوا على خير وشكرا للمتابعة.